Hi, Dr. Dave Deal, DuPont Family Dentistry. I want to show you pretty quickly, as best I can, what it's going to be like when you come to the office over the next few weeks. First things first is we have the automatic doors, so you don't have to worry about touching anything there. As you come on into this area, we've installed touchless sensors for the doors as well on the inside of the office. So as you come in, wave your hand, door opens up. And please forgive us, we're doing a little bit of construction still, so there's some things still going on. As you come into the reception area, first things first, when you first drive up, stay in your car. Give us a call. We'll know that you're here, and when we are ready, we would like to have one person at a time come into the office and not have too many people coming in at once. So the girls will call you or text you and say, now it's your turn to come in. So just wait in your car, give us a call, let us know you're here. Once you come in, the first thing that we're going to ask you to do is to use a hand sanitizer. Sanitize your hands, make sure those are clean. Next thing is, we got another touchless sensor. So come on back to this next area here. And once we get about here, either Sandy or Kyla or Kathy are going to take your temperature. We have these little probes that will, we just have to kind of aim it at your forehead. We'll take your temperature. If you're less than 100-degree temp, then we're going to see you. If you're over that, then we're going to ask that you go home and reschedule it, just for any kind of concerns and safety. As you come into the office, you're going to see that we've installed barriers. We've got these plexiglass barriers that Becca and her husband Dave made for us, and they're awesome. I feel so grateful that they were able to do this for us. That was a big blessing. As we come back through the operatories and you start going in this area, you're going to notice something that's kind of funny, but it's useful. We've installed shower curtains. We have shower curtains between any area that we're treating patients or anywhere where we're cleaning instruments. And the idea here is that we're going to prevent as much air movement, try to diminish the aerosols that are created and diminish the chances of them moving throughout the office. So it's really important. And we have those kind of everywhere here. And again, sorry, I have some construction going on. So now once we get back to the operatories, there's a few things here I'm real excited about. The first thing is, this is kind of brand new. We have something called a Zyber Shield. And this Zyber Shield was just recently invented. I was actually thinking of doing the same thing, and then someone beat me to it. But this is a shield that, as a patient is in the chair, we lay them back, we can position this plexiglass shield over their face, and it creates a barrier between ourselves and the patient. And what's really nifty, if you can come in a little closer, Sandy, is that we have suction hooked up to this as well. So as a patient setting here, and we're working on them, and if there's an aerosol that's created, this tube is going to suck the aerosol out, and it's going to prevent it from going anywhere. That's a really cool tool. I'm very excited about having these. I'm pretty darn sure I'm the first one to have them. Next to that, we have, this is called a dry shield. And this is another tool that we've been using for a long time, but now we're getting more of them in the office and the hygiene side too. This is something that goes inside a patient's mouth while we're working, creates separation, and it creates a vortex, a vacuum vortex, where it pulls all of the aerosol out of their mouth or coming out of their mouth as we're working. These are really, really good. We've been using these for a couple years, and now we're having them implemented in the hygiene side too. This is going to take care of probably about 90% of the aerosol, and I would imagine this is going to take care of the rest. So those are some of the basic things that we're doing to protect you and to protect ourselves. Aside from that, we have gone even above and beyond that. The heating and air conditioning system in the office has been redesigned or has been modified. And we have, it's called plasma bipolar ionization. You gotta look it up, it's really fascinating stuff. Hottest topic in dentistry is how do we keep the air clean? And there's a bunch of different ideas, and this one's really, really state of the art. So all the heating and air conditioning units in the office have been fitted with these things. So as you go throughout the day, the air is constantly being sterilized, removing viruses and bacteria and everything that it possibly can, molds of course, out of the air. We had them installed yesterday, and I can already kind of feel or smell a difference in the air. I think it's better. So as that works, that's just going to continue to protect us. Aside from that, we've even gone an extra step. I have ordered, they're not here yet, but these little portable, they're medical grade HEPA filters and UVC lights. It's a little air filtration system we'd put in each operatory, and we'll try to get as close to the patient, to the staff as possible. And those are going to further clear the air and clean it as well. So we've done everything we can to protect you and to protect ourselves. Really can't think of much else. So we're ready for you when we return. We're excited to see everybody, and we're excited about getting back to work and doing what we love to do. And you know, like Sandy said, You know, we've been given new hope for your smile for a long time. Now we're giving you, what'd you say, Sandy?
Oh my gosh, I don't know how I worded it. New hope for the future, I think.
Yeah, comfort for the future. So we're excited about all the things that are going on here, and we cannot wait to see you.